discuss about the diabetes. Diabetes describes a group of a metabolic disorder in which the person has a high blood glucose, that is blood sugar, either because insulin production is inadequate or because the body cells does not support properly to insulin, or sometimes in correlation with the both conditions. What is insulin production? Pancreas are the organ which produce the insulin. In pancreas, the beta cells are particularly the beta cells are responsible for the production of the insulin, which is responsible for the maintenance of the glucose level within the body. What happens if there is a problem with the production of the insulin? Glucose in blood is not able to go into the cells. Firstly, this is the main important thing. Other is the cell can't meet energy need, and energy is tried to be provided from fat and protein. Third is usually fat as the energy source results the increasing of ketone in the body, which is usually known as ketoacidosis. With the usage of a protein as an energy source, the patient feels themselves tired and sluggy. If the blood glucose is too high, it is tried to be thrown away by kidneys, so the patient being to urinate so frequent and often, which is also termed as frequent urination. As a result, the patient feels thirsty and starts to drink a lot of water. On the other hand, despite eating so often, and a lot of patients lose weight also. These are some type of a symptom which we usually seen in the diabetes patient. The type of a diabetes includes type 1 diabetes, type 2 diabetes, impaired glucose diabetes, or gestational diabetes, and many more others. While type 1 and type 2 are the most common form of a diabetes, these are other than you may heard about the impaired glucose metabolism or pre-diabetes. These are two pre-diabetic conditions. Impaired glucose tolerance is where the blood glucose level are higher than normal but not high enough to be classified as diabetes. Impaired fasting glucose is which is usually known as IFG, is where blood glucose level are escalated in the fasting state but not high enough to be classified as a diabetes. Type 1 diabetes. Type 1 diabetes is usually diagnosed in children and a young adult. Only 10% of the people with diabetes have this form of diabetes. In type 1 diabetes, the body does not produce insulin. Patient with type 1 diabetes will need to take insulin injection for the rest of their life. They must also ensure proper blood glucose level by carrying out regular blood tests and followed to a special diets also. Type 2, apart from type 1 diabetes, type 2 diabetes, the body does not produce enough insulin for proper functioning. Therefore, we need to take insulin from the external source, which is also known as insulin dependent diabetes mellitus, or the cell in the body does not reach to insulin. Approximately 90% of all cases of the diabetes in a worldwide are this type of a diabetes. This means the type 2 diabetes. Some people may be able to control their type 2 diabetic symptoms by losing weight, following a healthy diet, doing plenty of exercise, and monitoring their blood glucose level regularly. However, type 2 diabetes is typically a progressive disease. It gradually gets worse and the patient will probably end up have to take insulin, usually in a tablet form or sometime in an injection form also. Overweight and obese people have a high risk of developing type 2 diabetes compared to those with a healthy body weight. The risk of developing type 2 diabetes is also greater as well, and greater as we get older. Men whose testosterone levels are low have also been found to have a high risk of developing type 2 diabetes. Apart from type 1 and type 2 diabetes, gestational diabetes. This type affects female during pregnancy. The majority of the gestational diabetic patients can control their diabetes with exercise and diets. Undiagnosed or the uncontrolled gestational diabetes can rise to risk of complication during childbirth and during pregnancy conditions. The baby may be bigger that he or she should be. causes diabetes? Diabetes causes vary depending on your genetic makeup, family history, ethnicity, health, and environmental factors. There is no defined diabetic causes because the causes of diabetes vary depending upon the individual and the types also. What are the symptoms of the diabetes? First is always tired. Second is frequent urination. Third is sudden weight loss. Fourth is wound that would not heal. Third is fourth is sexual problem. And apart from that, you always feel hungry, blurry vision, and numb or tinning hands on feet, always thirsty, and vaginal infections also. These are the type of symptoms which you usually feel in the diabetes type 1 and type 2, and apart from type 1 and type 2 gestation diabetes also. How are diagnosed and pre-diabetic condition? How are diabetes and pre-diabetes condition diagnosed? Blood tests are used to diagnose diabetes and pre-diabetes. Lab analysis of blood is needed to ensure test results are accurate. Glucose measuring device used in the health care provider office such as finger stick device are not accurate enough for diagnosing but may be used as a quick indicator of a high blood glucose. Diabetes treatment. Prevention and treatment often involves physical exercise, being a normal body weight, and healthy diet. Diet plan. Daily nutritional needs should be taken frequently but small portions. Below are some diabetes myth. People with diabetes should not exercise. That is not true. Exercise is important for people with diabetes as it is for everybody else. Diabetes patients should discuss exercise with their doctor before starting the exercise. Another myth is fat people always develop type 2 diabetes eventually. This is also not true. Being overweight or obese raise the risk of becoming diabetic. They are risky factor, but do not means that an obese person will definitely become diabetic. Another myth is children can outgrow diabetes. This is also not true. Nearly all children with diabetes have type 1 insulin producing beta cells in the pancreas have been destroyed. These never come back. Children with type 1 diabetes will need to take insulin for rest of their life unless a cure is found one day. Other myth is only elder people develop type 2 diabetes. Things are changing right now in the current scenario. A growing number of children and teenagers are developing type 2 diabetes due to their explosion in childhood obesity rate, poor diet, and physical inactivities. If you have diabetes, who can't eat chocolate or sweet. People with diabetes can eat chocolate and sweet if they combine them with exercise or eat them as part of their healthy meal. The other myth is diabetes cannot eat bread. Diabetic person cannot eat bread, potato, or pasta. People with diabetes can eat starchy food as well. However, they must keep an eye on the size of the portion. Other myth is diabetes diet are different from other people. The diet doctors recommend healthy nutrition, healthy for everyone. Meals should contain plenty of vegetable, fruits, whole grains, and they should be low in salt and sugar and saturated or trans fat. Some complication linked to badly controlled diabetes. First is eye complication, which we usually face like glaucoma, cataract, diabetic retinopathy, and some other type of a complication related to the eye disorders. Other is foot complication, that is neuropathy or sometimes gangrene where the many required that the foot be amputated. The other is heart problem, heart disease when the blood supply to the heart muscle is diminished. Other is hypertension. Apart from hypertension, there is mental health, hearing loss, and gastroparesis and stroke. These are some type of a complication which we usually face during the diabetes if we can't control diabetes or blood glucose level properly. What can be done for the diabetes at school level or at a college level or at a working level? Brochure and film should be prepared to inform the student या colleagues or employees related to the diabetes. Students should be informed about the importance of a healthy eating and doing exercises. School canteen should be controlled and want to sell health food and healthy drinks rather than fast food and the fizzy drinks. Students should be informed about not eating fast food. Parents should be informed about healthy nutrition and the importance of the homemade food in children's bag. Teachers should follow their students about their healthy problems. If they have any symptoms with any disease, they should contact with their parents. They also should inform the school or college about the importance of their health. Thank you so much.